What is the difference between NVLD and autism? What is the difference between nonverbal learning disorder and autism spectrum disorder? This question is important for understanding how these two conditions affect individuals differently. While both conditions can share some traits, they have distinct characteristics that set them apart. Nonverbal learning disorder primarily involves challenges with visual-spatial processing and fine motor skills. Individuals with nonverbal learning disorder often excel in verbal abilities but struggle with interpreting nonverbal cues. This means they may have difficulty understanding facial expressions, body language, and tone of voice. As a result, their social interactions can be affected. However, their social difficulties usually stem from these nonverbal communication challenges rather than broader social communication issues. On the other hand, autism spectrum disorder is characterized by difficulties in social communication and interaction. Individuals with autism spectrum disorder may face challenges with both verbal and nonverbal communication. They often display restricted interests and repetitive behaviors. Sensory processing differences and a preference for routines are also common in autism spectrum disorder. When it comes to learning and processing information, children with nonverbal learning disorder tend to learn better through listening. Their visual-spatial processing is impaired, which can lead to academic challenges. They may struggle with organizing visual information, experience poor math fluency, and have slow processing speeds. In contrast, many children with autism spectrum disorder are strong visual learners. However, they may face delays or differences in learning due to sensory processing issues and social communication difficulties. Motor skills also differ between the two conditions. In nonverbal learning disorder, motor skill challenges are related to visual-spatial organization. This can result in clumsiness or poor coordination. In autism spectrum disorder, motor difficulties often arise from sensory processing differences and may include repetitive motor behaviors. Social skills and behavior can overlap in both conditions. Individuals with nonverbal learning disorder and autism spectrum disorder may experience social anxiety, difficulty making friends, and trouble with changes in routine. However, individuals with autism spectrum disorder often show a wider range of social communication challenges. They may struggle with both verbal and nonverbal communication and exhibit restricted interests and repetitive behaviors, which are not typical features of nonverbal learning disorder. It is also important to note that it is possible for someone to be diagnosed with both conditions. However, having one does not automatically mean a person has the other. The similarities between nonverbal learning disorder and autism spectrum disorder can make differential diagnosis challenging. Therapies and interventions may overlap, focusing on improving social skills, motor coordination, and coping strategies for both conditions. In summary, nonverbal learning disorder mainly involves visual-spatial processing and nonverbal communication challenges, while autism spectrum disorder encompasses broader social communication difficulties, sensory processing differences, and restricted behaviors. Understanding these differences helps tailor appropriate support for each individual.